The National Institutes of Health oversee every aspect of healthcare in our country, from cradle to grave. It is our healthcare North Star. It ensures medications are safe and effective. It keeps workers, students, and seniors safe. It protects the public from global pandemics or disease outbreaks. It guarantees hospitals, doctors, and community health centers provide safe, quality care. It fights for affordable medicine, tests, and treatment. And it funds research that will build the foundation to accurately diagnose patients, better treat cancer, cure Alzheimer's, and combat the debilitating diseases that impact countless American families. We know HHS as Health and Human Services, but it also stands for Human Health Security. And the stakes are life and death. Donald Trump knows this full well. In the final year of his first term, the COVID-19 pandemic killed 350,000 people in the United States, and nearly 92,000 died of drug overdoses. That was the final year of Donald Trump's presidency. We now know that more than 1 million Americans would die during the pandemic, and that life expectancy would drop to its lowest level since 2003 under Donald Trump. With this understanding, Donald Trump picked Robert F. Kennedy Jr. to lead HHS, a man who has questioned the well-proven conclusion that HIV causes AIDS, made millions by spreading lies about vaccines, compared vaccine mandates to Nazi Germany, said Wi-Fi and cell phones cause leaky brains, threatened to remove fluoride from drinking water, and made baseless claims that medication for depression led to mass shootings. In 2019, Mr. Kennedy spread lies about the measles vaccine that contributed to a measles outbreak that killed 83 people in Samoa. Most of those were children and babies. Robert Kennedy Jr. and his lies cost lives. He is dangerous, unqualified, and unserious. And to fill out his bench of health system henchmen, Trump has selected officials to lead our public health institutions who opposed mask requirements during the pandemic, who peddle medical quackery to sell products, and who have advocated to restrict abortion rights. That's not a healthcare cabinet, it's a healthcare cabal. And it is through the work of these critical agencies that control vaccine policy, drug approvals, and food regulation that Robert Kennedy Jr. may trade healthcare for health conspiracies. The American people deserve more from its government. They deserve more than a Trump administration filled with power-hungry politicians, fame-whoring celebrities, architects of Project 2025, and corporate CEOs and billionaires who slash corporate taxes and pay for it by gutting linchpin public health institutions and attacking programs that help people get health care and afford food. They deserve more than an administration that will peddle in lies and misinformation, who are anti-science, and whose bottom line is only the bottom line. Mr. Kennedy and I do agree on one thing. We have work to do in our healthcare system. Too many Americans are drowning in medical debt. Too many Americans skip or ration their medication because they cannot afford it. They don't go to a doctor because they know it will cost too much. The paperwork is too complicated, or the wait times are too long. Healthy, nutritious foods that can keep people fed are too expensive or hard to find. Emergency rooms are filled with the consequences of the opioid epidemic and mental health crises. And people here in Massachusetts, they know that we've let corporate greed infect our healthcare system, shutting down hospitals, hurting patients, and driving healthcare workers out of their jobs. These problems demand a trusted, informed, qualified leader. Robert Kennedy Jr. is not that leader. The healthcare system needs real leadership, and Robert Kennedy Jr. cannot and will not provide that leadership for the health of the families of our country. As a member of the United States Senate, it is my and my colleagues' responsibility to advise and consent on nominations. Every nominee must be subject to full vetting, examination, and questioning for their positions, statements, and past affiliations. With the stakes of these nominations and the scope of their potential responsibilities, we must not allow Donald Trump to turn advise and consent into the demise of consent. That is what he is hoping his Republican colleagues will agree to provide him. No real process for looking at the background of these candidates. And in the public health sphere, advise and consent is key to ensuring that the health of every family in our country is going to be protected by the Department of Health and Human Services. If Donald Trump seeks to use recess appointments to circumvent the advise and consent process, then I am going to fight him every single step of the way. Where these nominations present a threat to Americans' health and safety and security, I am going to vote no. I will vote no on Robert Kennedy, and I will vote no on any nominee that jeopardizes the public health and safety of families in our country. With Robert Kennedy Jr., the threat is clear. I'm going to vote no on Robert Kennedy Jr.'s confirmation, and I hope that other members of the Senate, Democrats and Republicans alike, will also vote no, so that Donald Trump presents someone who in fact has the qualifications to run the healthcare system of our country. As the chair of the Health, Labor, and Health Subcommittee of the Health, Education, Labor, and Pensions Committee, I have fought for a better healthcare system. I will keep up that fight, and I will fight until every American can afford to keep a roof over their head, feed their families, and get the health care which they need. This is going to be one of the most important decisions which our country makes. We have dramatically expanded the life expectancy of the American people over the last 100 years. And much of it is because of vaccinations. Much of it is because of healthcare interventions. In 1900, life expectancy in our country was 48 years of age. We have now extended it out to the late 70s, 30 bonus years of life. And it's mainly because of public health interventions. We cannot allow that to be jeopardized. We must continue to expand the life expectancy of Americans, not contract it by raising questions about vaccines and other public health interventions that have served our nation well. Ralph Waldo Emerson from Boston once said that health is the first wealth. That is why we're here. We're here to talk about that first wealth, because without health, you have nothing. And that is why we are going to fight the nomination of Robert F. Kennedy. So now let me turn and introduce Omi Amar Singham. Welcome.
Thank you, Senator. Good morning, everyone. My name is Omi Amara Singham, and I'm the Deputy Director of the Massachusetts Public Health Alliance, or MPHA. The public health community is alarmed by the announcements we have heard thus far from the incoming federal administration about how it plans to manage matters of vital importance to the health of the people of Massachusetts and this country. As we saw during the COVID-19 pandemic, health is not simply a matter of personal choice. Public policy and government programs have a significant role to play in creating the conditions for people to be healthy. 80% of one's health is created in the social and structural conditions where we live, work, and play. Fairness demands that we address the gaping disparities in the health of people across races, ethnicities, economic standing, immigration status, sexual orientation, gender identity, and the entire range of socioeconomic demographics. To do this, health policy must focus on health equity and trustworthy science-based evidence. When it comes to our health, no person is an island, and this is particularly the case with respect to infectious disease. Vaccines are one of the greatest achievements of biomedical science and public health. Strategic vaccination campaigns in the last century have virtually eliminated diseases that previously were common in the United States, including diphtheria, tetanus, polio, smallpox, measles, mumps, and rubella. Vaccinations have prevented enormous suffering and premature death. In fact, the vaccination of children born in any given year prevents an estimated 42,000 premature deaths and 20 million cases of disease. Health policy has the power to save lives on a large scale, and it must be grounded in the best available science. We are deeply concerned about backsliding, but backsliding is not inevitable. While we are bracing ourselves for what's to come at the federal level, we are also working overtime to ensure that Massachusetts' state and local public health infrastructure is ready for whatever comes. I want to assure the people of Massachusetts that not only do you have fighters in our federal delegation, led by champions like Senator Markey, you also have public health leaders working in every community across this state. Municipal public health departments and our state Department of Public Health, led by Commissioner Robbie Goldstein, work tirelessly behind the scenes every single day to ensure that we are prepared to meet the public health challenges of today and tomorrow. Just this month, the legislature passed and Governor Healy signed landmark legislation to make our local public health system even stronger, ensuring that Massachusetts residents will be able to access basic public health protections in every region of the state. No matter what happens in Washington, Massachusetts state and local public health officials have your back, as Senator Markey and the rest of our federal delegation do. We at the Massachusetts Public Health Alliance are grateful every day for their public service. Thank you.
Beautiful, thank you. Next, we're going to hear from Andrea Friedman from the Public Health Institute of Western Massachusetts. Welcome.
Hello, my name is Andrea Freeman. I'm the Policy Director with the Public Health Institute of Western Mass. We're proud to stand with Senator Markey to express our grave concern about the nomination of Robert Kennedy Jr. to lead the Department of Health and Human Services. While we recognize the nominee's past accomplishments as a lawyer who worked to clean up rivers and to fight toxic pollution, it is in his incoherent relationship with science and his eagerness to misspread information over the past 20 years that compel us to strongly oppose his confirmation as a cabinet member. Robert Kennedy Jr. is not the only person spreading information about fluoride, about vaccines at the FDA, about Dr. Fauci, but with his famous name, he's been unfortunately able to mislead too many Americans. Appointing a public servant who undermines vaccine confidence is not just misguided, it's reckless. And the ripple effect of parents choosing not to vaccinate their children puts public health and our children's futures at risk for decades to come. We cannot afford an HHS secretary with a track record of misleading the public. The Department of Health and Human Services is the backbone of our nation's health response, whether it's safeguarding communities against pandemics, addressing health disparities, or ensuring access to affordable care. The work cannot succeed without leadership rooted in science and guided by evidence. Since the days of Paul Revere, when Boston established its first public health department to avoid suffering, the public health has been steadfast in its mission to prevent disease and promote health for everyone. Science is the foundation of every element of public health. And that commitment has led to groundbreaking improvements in life expectancy, as the senator pointed out, and to the quality of life. And now is not the time to roll back the headway that we've made. We're still confronting serious health challenges such as chronic diseases, health inequities, and emerging threats like climate change, which is why we truly need and deserve an HHS secretary who prioritizes science and fosters collaboration. So let's not put our heads in the sand and allow what is working to unravel. Instead, let's recommit to evidence-based decision-making to improve the health and well-being of all Americans. Thank you.
Thank you, Andrew. And next, we're going to hear from Ellen McGinnis from the Massachusetts Nurses Association. Welcome.
Thank you, Senator. Good morning. My name is Ellen McGinnis. I'm a member of the Massachusetts Nurses Association, representing more than 25,000 nurses and healthcare professionals from Cape Cod to the Berkshires, whose members have, for more than a century, advocated for high-quality patient care based in science and policies that protect the health for all of our residents. We need to have a Secretary of Health and Human Services who has scientific credentials and public policy background necessary for this position. The Secretary of Health and Human Services will oversee every aspect of healthcare delivery with the ability to make decisions that could negatively impact and undermine the health and safety of millions of Americans and our children. As nurses and healthcare professionals, we have a legal responsibility and an ethical responsibility to protect the public health and speak out in any instance when the lives of our patients and the safety of our communities are placed in jeopardy, which is why we are here today standing with Senator Markey to voice our strong opposition to this appointment. Thank you.
Thank you, Ellen. And next, we're going to hear from Mavis Nemo of Tapestry Health Systems Incorporated. Welcome.
Thank you so much, Senator Markey. Hello, my name is Mavis Nemo, and I am the CEO of Tapestry Health, which was one of Massachusetts' first family planning organization and formed on the heels of Roe v. Wade over 50 years ago. We are in the western part of the state and are a critical safety net for the region, providing sexual reproductive health services, as well as harm reduction services and WIC program. We also operate a mobile health van. Last fiscal year, we had over 40,000 touch points to residents needing our services across our region. The communities we serve are a vibrant tapestry of nationalities, culture, race, religion, sexual orientation, gender expression, and geographically diverse. And they are often the most marginalized of all denominations, of all race. And so we have worked with individuals who have the long-standing social and structural inequities that limit their ability to access high-quality, comprehensive health care. As a community-based organization doing this work, we are most concerned with the funding mechanisms that literally save and affirm lives. The United States Health and Human Services is the largest grant-making agency for states, for territories, for tribes and organizations like us. We're specifically concerned with Title X funds and the threats to Title X, which fund organizations like Tapestry, which help people in your communities, and countless others across the United States, serving millions of people. We're also concerned about things like Medicaid and programs that research disease and act upon evidence. We're concerned about the treatment, intervention, and prevention of addiction and about saving lives and programs that are ultimately a lifeline for all Americans. This has been and always was the goal of Health and Human Services, to protect and care for the well-being of people, to prepare us for pandemics and disasters, to advance science and provide that safety net for the most vulnerable. Our ecosystems and survival are intertwined. No society can purport to meet the indelible ideals of liberty and justice with an unwell populace for everyone. We must stand hand in hand, shoulder in shoulder, fervent in our efforts to protect the health and future of America.